Breaking new ground in swine health, a conversation on Pradalex with Dr. Jessica Risser from Elanco Animal Health. Welcome, Jessica.
Hi, Jim. Thanks for having me.
So we got another episode of Swine Health Insights. It's really exciting times at Elanco with Pradalex. What makes it different from other antimicrobial treatments currently available for swine respiratory disease? And how does the fluoroquinolone formulation enhance efficacy?
Yeah, thanks for asking. We're bringing news on Pradalex. Pradalex is a antibiotic injection product that was approved by the FDA in 2024, but now available for purchase, and it's for the treatment of swine respiratory disease. It is the first unique injectable antibiotic since the mid-2000s that's been approved. So we're excited about it. Pradofloxacin, the active ingredient in Pradalex, is a novel third generation fluoroquinolone, which just means it's new and novel. It differs from other antimicrobial treatments in a couple reasons, and I'll touch on those. One, because of the speed at which it reaches a high serum concentration, because it is a concentration dependent antibiotic that's really important to cause bacteria cell death in both the replicating and resting state. And it reaches that peak serum concentration within only 45 minutes following administration. So it's really nice for the producers and the veterinarians prescribing this medication because it reaches that peak serum concentration and get to the site of infection rather quickly and then start working. The other differentiator that I wanted to mention was the mode of action. So it's different from other antibiotic classes that are in this space for swine respiratory disease, like beta-lactams that have been around for a long time, macrolides, and then fluoroquinolones. There are other fluoroquinolone antibiotics that it is differentiating itself from. Beta-lactams work on the cell wall. Macrolides work in the cytoplasm with the ribosomes to inhibit protein synthesis, and fluoroquinolones work on the genetic machinery of the bacteria. Two essential enzymes, DNA gyrase and topoisomerase 4. And I know this is getting really, really technical, but it's really important because these enzymes help to in the bacterial replication process, but also in just their steady state living to help them survive within the animal. So by inhibiting both of these enzymes simultaneously, and that's where it's Pradalex is different than other fluoroquinolones. Other fluoroquinolones work on one of those enzymes at a time, but Pradalex works on both of those enzymes at the same time in the same bacteria. So it has a dual action there, and that really helps to um, reduce the activity of those enzymes in the same organism and kill it quickly and effectively.
So, Jessica, with antimicrobial stewardship being a critical focus in the industry, how does Pradalex align with responsible antibiotic use? And then what protocols should veterinarians follow to ensure its optimal application?
This is a great question and one that's really important to me is antimicrobial stewardship. Um I sit on the Pharmaceutical Issues Committee for the AASV, and so that's one of our jobs, right, is to talk as an industry, as a collaborate with other swine veterinarians on how we can safeguard antibiotic use into the future. And as required by the FDA, U.S. veterinarians have to instruct the use of fluoroquinolones according to the label. So that's a really important point to point out here. Since Pradalex is a fluoroquinolone, it needs to be used as labeled. And that's for the treatment of swine respiratory diseases associated with five bacteria: Bordetella bronchiectasis, Glasserella parasuis, Pasteurella maltosida, Streptococcus suis, and Mycoplasma pneumoniae. And even more importantly as well, it's labeled for pigs post-weaning to market. So nursery, growing, and finishing swine, and then any of those adult swine that are intended for slaughter, but not for swine intended for breeding or nursing piglets. And that's just because the FDA does regulate this product very closely, and we did not do studies in those phases of production, and so they asked us to put that on the label. So that's one way, leading towards antimicrobial stewardship is making sure that producers are using the product as veterinarians are prescribing it in accordance with the label. Another not caveat, but another point about Pradalex and mentioned previously is that it relies on that high drug level to rapidly kill the bacteria. It reaches high serum concentrations within 45 minutes of administration, and then it's eliminated from the treated animal with a withdrawal time of 2 days. So, pradafloxacin, the active ingredient, is only for a short amount of time at a concentration level that's conducive to the development of antibiotic resistance. And this facilitates Pralex as a highly efficacious treatment while minimizing the risk of antibacterial resistance, which, of course, is another step towards safeguarding antibiotics for the future. I have some general points too, not related to Pradalex, but related to all antibiotics of how veterinarians and producers can use antibiotics judiciously and as part of an antimicrobial stewardship. I think these are good reminders for everybody. Producers should seek management practices that prevent disease with priority to the basics, quality and quantity of water, fresh air, quality feed, and then preventative health practices such as vaccinations that can assist in prevention of disease and reduce the need for antibiotics. As always, and especially with Pradalex, it's important to recognize individual animals that need treatment. This is a treatment medication, so we want to identify those pigs early, as soon as they have clinical signs, so that we can get them treated and help with the response and recovery from disease. And then communicating that prevalence of what we're seeing in the barn to our veterinarians so they can help discern, well, does a group medication need to be administered to help control the disease? And as I mentioned, and I'll reiterate this, it's important for producers to follow the veterinarian's prescription instructions. Administering the antibiotics the veterinarian has selected for the pathogen causing the problems in the barn and following those instructions on dose and duration of treatment.
So respiratory disease remains one of the biggest challenges in swine production. How does Pradalex fit into a broader earth health management strategy to minimize disease impact and improve the long-term performance?
Yeah, so with Pradalex being labeled for treatment only, and as I mentioned, those five swine respiratory disease pathogens, Bordetella, Glasarella, Pasteurella, Strep, and Mycoplasma, it's really important to think about, as you're asking, about how it fits into a health management plan because it is for treatment only, and that's different than control or prevention. And then we have some labeled restrictions on what phase of production, the nursery, growing, and finishing swine, those pigs deemed being sent to market, is the phase of productions that we can use this product in. So just a reminder, treatment is administration of a medicine to a clinically sick pig, right? You have obviously clinically sick pigs that you're going to treat and help them recover from that illness. Control, by definition, is when we have a group of pigs that we're going to administer a medication to, and a portion of them are clinically sick, but we're trying to get ahead of it to make sure the rest of the group doesn't get sick. And then prevention is where we want to administer a product to a group that is from maybe the same sow farm, the same flow, but in the previous flow had a history of disease and a certain pathogen, and we want to go ahead and get ahead of that before anyone gets clinically sick. So I just want to differentiate those because Pradalex is for treatment of when we have clinically sick pigs, and we were going to individually treat those pigs. So what it makes is it makes it a great option as a follow-up to your prevention and control strategies because you may still have some pigs that break through or have a high level of infection that will still become clinically sick. And so Pradalex is a good follow-up to those strategies for individual treatment of pigs.
Great information, Jessica. Now we're going to get you out of here on this. Given its broad spectrum coverage and short withdrawal period, what specific scenarios or disease outbreaks made Pradalex the most effective treatment option for producers and vets?
Yeah, I've reiterated this multiple times, but it has the 5 swine respiratory disease pathogens on the label and the 2-day withdrawal time. So additionally, some things about Pradalex that are convenient is that it's administered one time. It's a one-dose antibiotic, and it has a lower volume of dose than other products that are labeled for swine respiratory disease. So this makes it pretty convenient for animal caretakers to administer when faced with a pig with clinical respiratory disease from wean to market. The other nice convenience of that, because of the concentration of the active ingredient, and that no more than 5 mils can be administered into any one intramuscular injection site. That 5 mil dose can actually be enough for a 294-pound market hog. So it's really only one injection from wean all the way to market. So we don't have to worry about multiple injections. And with the withdrawal time of 2 days, it does make it a pretty convenient option for those late finishing Mycoplasma high pneumonia breaks, because that is one of the pathogens that's on the label. So we've seen that as a place where some early adopters have implemented Pradalex. Another place is in nursery pigs and some of the more complicated flows where previous groups have seen a history of multiple pathogens on the label and they haven't been as happy with their previous treatment plans. These customers have reported an improved livability of those pigs post-treatment with Pradalex and a decreased need for follow-up treatments with other products. So we're pretty excited about how Pradalex can fit into a veterinarian's herd health plan.
Dr. Jessica Visser, thanks for joining us on Swine Health Insights.